Bienvenidos. Welcome to today's webinar entitled Prevention of Prescription Drug Misuse Among the Latino Community. My name is Dolca Michelle Zelaya. I'm the project coordinator for the National Hispanic and Latino Prevention Technology Transfer Center. I will be your host for today's webinar. Before I introduce you to our guest speaker, here are some brief instructions about today's presentation. The webinar will be recorded and archived for future playback. It will be closed captioned in Spanish and eventually also in Portuguese. A copy of today's presentation will also be made available after the webinar. The lines will be mute throughout the presentation so as to minimize background noise and other interference. When we get to the Q&A portion of the webinar, you will have an opportunity to ask questions by typing into the Q&A box, and I will present your question to our presenter. We'll also be asking you to fill out a brief survey at the end of the webinar. This satisfaction survey is important to the work we do and provide us the opportunity to improve our training efforts. Although we did not secure continuing education credit for this event, we plan to do so for future events. So let's begin. Let us start by introducing the National Hispanic and Latino Prevention Technology Transfer Center and our team. The National Hispanic and Latino Prevention Technology Transfer Center is housed at the National Latino Behavioral Health Association, NALBA, located in New Mexico. NALBA was established to fill a need for a unified national voice for Latino population in the behavioral health arena and to bring attention to the great disparities that exist in areas of access, utilization, practice-based research, and effectively trained personnel. Our National Hispanic and Latino Prevention Technology Transfer Center is part of the PTTC network. It's comprised of 10 domestic regional centers, 6 international HIV centers, funded by PEPFAR, 2 national focus area centers, and a network coordinating office. Together, the network serves 50 U.S. states, the District of Columbia, Puerto Rico, the U.S. Virgin Islands, and the Pacific Islands of Guam, American Samoa, Palau, and the Marshall Islands, Micronesia, and the Mariana Islands. The International HIV PTTC serves Vietnam, South Asia, South Africa, and Ukraine. Here you will see the map of the US-based PTTCs. The National Hispanic and Latino Prevention Technology Transfer Center has a national focus for Hispanic and Latino communities and the workforce that provides service to these communities. The PTTC is staffed by Dr. Pierluigi Mancini, our program director, Alex Santos, executive administrative assistant, and myself, Dolca Michelle Zelaya, program coordinator. The Latino Health Association is also home of our sister Addiction Technology Transfer Center. We will provide our contact information at the end of this webinar. Now, it is my pleasure to introduce today's presenter, Ms. Diana Plaza. Diana Plaza is originally from Bogota, Colombia, who came to the United States in 1999. Diana received her prevention specialist certification in 2013 and her bachelor degree in psychology with a concentration in substance abuse in 2017. Diana began her work in prevention in 2010 at CEPA, Georgia-only Latino Behavioral Health Agency. In 2012, she became the statewide coordinator for the Alcohol Prevention Project at SEDPA, where she led the development, delivered, and oversight the 5 bilingual and bicultural Latino alcohol prevention programs. In 2013, Diana became the director of SANSA-funded GenRx project. GenRx was created in response to the prescription drug abuse epidemic in the United States. GenRx in Georgia aims to prevent the misuse, abuse of prescription drugs among 12 to 25 years old in 3 counties in Georgia. Diana leads the efforts in Gwinnett County as she has focused in developing strategies and solutions to address the problem in Hispanic Latino communities since its inception. Diana's prevention work has been recognized by the Academy of Television Arts and Science twice. First, in 2014, Diana and her colleagues in the Alcohol Prevention Project received an Emmy Award for their bilingual alcohol prevention documentary, Alcohol de No Drugs. And again, in 2016, she received an Emmy for the prescription drug documentary, Prescription Drugs Dangerously Legal. In 2017, Diana received the Prevention Champion Award from the Council of Alcohol and Drugs. Currently, Diana is pursuing her accreditation as an addiction counselor. Diana, welcome. Oh, the floor is all yours. Please proceed with your presentation.
Thank you. Hello, my name is Diana Plazas, and I'm the director of the GenRx program at SEDPA in Norcross, Georgia. I'm a certified prevention specialist. I have been working in the prevention field since 2010. Thank you for joining me today as I present my work on prevention of prescription drug misuse among the Latino community, a program called GenRx that I have led for the past 6 years, which is part of the SEDPA prevention department. Now, let me share briefly about what is SEDPA. So SEDPA is a nonprofit organization and behavioral health agency, which is specialized in mental health, addiction treatment, and emotional problems, as well as providing prevention service, including youth programs such as Mixtura Prevention Clubhouse and nutritional programs. So now let's talk a little bit about GenRx. So GenRx is an initiative to prevent prescription drugs misuse and abuse in the community. This program, founded by the Georgia Department of Behavioral Health and Developmental Disabilities, aims to educate the public about the proper use of prescription drugs, proper storage, and the disposal of drugs. GenRx is a response to the growing epidemic of prescription drug abuse among youth and young adults in Georgia. There were 3 counties chosen to work with this program in the state of Georgia: Catoosa, Early, and Gwinnett County, which is the county where I work for. So in 2013, Georgia Department of Behavioral Health and Developmental Disabilities, which is called DBHDD, conducted a study in Georgia about the use and misuse of prescription medication. The results show that Georgia is one of the principal states exported prescription medication in the country. One of the main routes used to transport this medication is the Interstate 85, which passes through Gwinnett County. Also, the report showed that Hispanic community was at the lowest awareness of the problem, and was for that reason that DBHDD reached out to SEDPA as a resource to begin an awareness strategy to help the Latino community, especially because Gwinnett has the largest Hispanic community in Georgia. This initiative started with 4 out of 12 cities in Gwinnett County. At the table on your screen, you can see the population of Gwinnett County. In the 4 cities we started the program in 2013, which were Lawrenceville, Duluth, Norcross, and Lilburn. So DBHDD and SEDPA follow the method of SAMHSA, the Strategic Prevention Framework, or SPIF, to check the community readiness and find the best strategies to work with Gwinnett County. This method uses a 5-step process known to promote youth development, reduce risk-taking behaviors, build access and resilience, and prevent problem behaviors across the lifespan. Sustainability and cultural competence are the base for every step of the strategic prevention framework. So this model requires to systematically assess their prevention needs based on epidemiological data, build their prevention capacity, develop a strategic plan, implement effective community prevention program, policies and practices, and finally, evaluate the efforts for outcomes. So to gather information about Georgia and Gwinnett County specifically, we use 6 Spanish focus groups and some national and state data. This needs assessment found that Hispanics in Gwinnett County was at the lowest level of community readiness, given as a number 1, no awareness at all. Results show lack of awareness regarding the problem of prescription drug misuse and abuse, and lack of knowledge of the proper storage and disposal sites, and parents were naive to the problem. Also, this process helped us to identify intervening variables and contributing factors combinations to work for. So one of the intervening variables was social access with 3 contributing factors. First one was a call to action for safe storage and disposal. The second one, access and information to lack of disposal sites. And third, an increased awareness among parents. The other intervening variable that we found, it was perception of risk with contributing factor of education on the health risks associated with prescription drugs, misuse and abuse. So original proposal included several strategies that have since been deleted. Initially, we planned to implement local take-back events and community activities, which will increase community participation, as well as provide a better platform for information dissemination and prevention activities. We heavily promote 2 local take-back events occurring 3 months apart, but were unable to engage community members at either event. It was clear to us at that point that this strategy definitely was not appropriate because of our community's low level of awareness. So after conferring with our technical assistance provider, we decided to abandon that strategy entirely, refocusing on our time and resources on our awareness campaign. So the logic model that you're seeing right now on your screen is the new one actually. So you can see the access or pharmacy bag campaign and social access awareness campaign. So because the Hispanic community was a social low awareness level, it was decided that designing strategies to intentionally overlap will create maximum impact. We changed, as I mentioned, the logic models, which showed the 3 new strategies we will implement. First, as I mentioned before, a pharmacy bag campaign. The second was a social access awareness campaign. And a third one that you're seeing right now on your screen is the at-risk awareness campaign. So our implementation strategies, we designed our perception of risk awareness campaign to begin in April 2014 until December 2014. For this campaign, we create a PSA for movie theaters. 2 companies, NMC and Screen Vision, help us in the development of the messages and the running them into the local Gwinnett County theaters. Beginning in June 2014, we implemented our social access awareness campaign, which included media campaign, educational interventions at Hispanic community activities, social health fair, and parents workshop presentations. Our media campaign included billboards in Spanish, newspaper advertisement running in Hispanic publications, as well as radio PSAs and interviewing airing on Hispanic radio stations. Finally, we implemented our pharmacy bag campaign in the middle of July 2014, lasting until our pharmacies run out of printed bags. So let's talk about our pharmacy bag campaign. The idea of this strategy came from the evidence-based program MATH sticker shock campaign. But instead of the stickers, actually, we decided to provide bags to the pharmacies. We noticed that many independent pharmacies distribute their medication on black, white bags, and some sell advertising. So we thought we could use that space to help educate the public about our campaign. Each pharmacy at the beginning get a packet which included a presentation letter, a letter from the Georgia Attorney General, a sample of the bag, a participation form, and a immersion evaluation form, which was collected at the end of the cycle that was every 3 months. From July 2014 to October 2016, we delivered 79,600 bilingual bags. That means English and Spanish only. So for our social awareness, access awareness campaign, our media campaign specifically, set out to reach as many Latinos as possible through newspapers, billboards, and radio stations. So let me talk a little bit of our results. So we have Mundo Hispanico, which is the biggest actually newspaper here in the state of Georgia. Mundo Hispanico prints 71,500 copies per week in the state of Georgia, and they have around 200,897 readers in Georgia. We had the Padres and Hijos magazine, 30,000 copies per month, around 90,000 readers in the state of Georgia. Guía de Salud magazine, it was a every 3 months publication, 30,000 copies every 3 months, around 90,000 readers in Georgia. Also, Mundo Hispanico, they have a digital website with approximately per month, they have 1,500,000 visitors, but in the state of Georgia, unique visitors computers, they have 350,000 per month. Also, they have a mobile application with approximately 1,250,000 visitors, but in the state of Georgia per month, unique visitors is around 285,000. Another newspaper helped us, it was El Estadio, which has approximately 20,000 readers per month. Also, we have in Nuevo Georgia, which has another big newspaper here in Georgia with a circulation of 20,000 copies, but their frequency is bi-weekly, every other Thursday. It's distributed in 32 cities in Georgia. Approximately, they have 300,000 readers. Also, we have Radio Información, which is a mobile application. We used to do Wednesdays around 30 minutes to an hour live program. The average monthly listeners were 30,000 people. We had El Patron radio station, which was at that moment the biggest radio station in Spanish, with approximately 168,600 listeners to the radio. Also, we have Radio Vida, which has a coverage of 96 counties in the state of Georgia. And finally, we had billboards reaching more than 10,000 people in Gwinnett only the county in Gwinnett. The digital message appeared every 10 seconds, so the total spots that we had, excuse me, was 44,604. So the other part of the social access awareness campaign were parents workshops. So our parents workshops were extremely successful during that time. During 2014 to 2016, we used a Spanish language PowerPoint presentation to educate community members about the dangers of prescription drug abuse among youth and about ways parents can help prevent such abuse. Also, the proper storage and disposal of medication. Typically, these presentations took place in local schools or churches. These presentations were for Spanish speakers only. Excuse me. The presentation was approximately 45 to 60 minutes in duration, followed by lengthy questions and answer sessions. We provided with a flyer to the person in charge at the school or at the church to recruit participants. So the flyer mentioned at the time hour, location, target community, specifically age, in this case only adults. So for that reason, we did not provide childcare service. We usually provide a small snack. Also, pre and post tests were administered prior to and after the presentations to assess the impact of the presentations on participants' knowledge and perceptions. A total of 195 workshops were presented with almost 300 participants during that time. So our campaign educational interventions or health fairs. So during this educational intervention, we pass out flyers with information about proper storage and disposal of the prescription drugs. Also, we had the opportunity to increase awareness about the issue through answering questions. So let's talk about our perception of risk. The goal of our bilingual perception of risk campaign was to educate parents about the danger of prescription drugs and to invite them to keep them in locked cabinets. During 2014, we ran a 15-second PSA through NCM in Regal Theaters, 36 weeks, 18 screens, and through a Screen Vision in a Studio Movie Grill, 12 weeks, 10 screens. Also, we have Telemundo, which is a Hispanic television network. We run 9 spots Monday through Friday for 2 months. We have around 720,000 Spanish audience covering the whole state. We have Azteca America, which is a small television network. We had 100 spots per 5 weeks, Monday to Friday. And of course, we have Univision, who we got 20 spots Monday to Friday, and Unimas, which is part of the Univision as well. We have 28 spots Monday through Friday. These both channels, Univision and Unimas, had 776,429 Hispanic viewers, approximately in the state of Georgia. So I want to show you actually messages that we play in the movie theaters. So let's watch.
Did you know that 1 in 4 teens has abused prescription medications? Must get them from family and friends. Every pill counts. Protect your kids. Lock up your meds. Text GENRX2 to 66746 to get your Fandango discount code.
Okay, let's watch the second.
Did you know that 1 in 4 teens has abused prescription medications? Most got them from family and friends. Every pill counts. Protect your kids. Lock up your meds. Text GENRX2 to 66746 to get your Fandango discount code.
Okay, now let's watch our television public service announcement.
¿Sabía usted que 1 de cada 4 adolescentes ha abusado de medicamentos recetados? Muchos los consiguen a través de familiares o amigos. Cada pastilla cuenta. Proteja a sus hijos. Guarde bajo llave los medicamentos.
Okay, the image on your left is actually the billboard that we had in Gwinnett County. And now let's listen to our radio PSA.
¿Sabía usted que 1 de cada 4 jóvenes ha abusado de medicinas recetadas? Muchos de ellos las consiguen en sus casas, de sus amigos o familiares. Esté alerta, vigile sus medicamentos, guárdelos bajo llave. Cada pastilla cuenta. Este es un mensaje de SEDPA, el Proyecto RX y el Departamento de Salud del Comportamiento y Discapacidades del Desarrollo. Mayor información en www.sedpa.org.
Okay, so we also developed a 30-minute bilingual documentary named Prescription Drugs Dangerous Legal to highlight the problem of prescription drugs in the Hispanic community in Georgia. The documentary was honored by the Academy of Television Arts and Science with an Emmy Award in 2016. All right, so what happened next? In 2017, DBHDD and SEDPA conducted a new needs assessment for Gwinnett County. This time, we included all cities and all ethnicities. One of the purposes of this new assessment and to include all cities and ethnicities was to check the current awareness of the issue in the Hispanic community in comparison to other ethnicities. For this needs assessment, 12 focus groups were conducted in the community using participants from 12 to 26 plus years old. 3 focus groups were middle school students ages 12 to 14, 3 groups of high school students ages 15 to 17, 3 groups of young adults ages 18 to 25, and finally 3 groups of adults ages 26 and above. In order to recruit participants, 2 flyers were created, one in English and the other a linguistically and culturally appropriate Spanish translation. Also, we had secondary data obtained from different sources, such as the National Survey on Drug Use in Health and Youth Risk Behavior Survey, as well as information from the U.S. Census Bureau. Statewide data was garnered from the Georgia Student Health Survey. Local data was taken from the Gwinnett County schools and government websites, and also local data on prescription drugs was taken from Gwinnett County, Georgia Student Health Survey. So let's talk a little bit about our secondary data. So something that we found out in the secondary data was the increase of use of prescription medication among young Hispanics. According to the tables that you're seeing on your screen, the number of young Hispanic abusing and misusing prescription medication has been increased in the nation in the last years. So on table 1 on your left, there is a significant difference in substance abuse rates in US-born and foreign-born Hispanic adolescents. So if you see the non-medical use of prescription type drugs, you can see that, for instance, 3% of Latino adolescents born in the United States reportedly abused prescription drugs in 2009, compared to 2.6% for their foreign-born counterparts. On table 2 on your right, that is a National Survey on Drug Use and Health 2016, show the number of Hispanics significantly increased in the last years, being the second ethnicity misusing prescription drugs. So continuing with our secondary data, here in Georgia, according to the Georgia Student Survey, the percentage of the students reporting any use of prescription drugs in the past 30 days. While the prevalence of use has declined in Catoosa County, it has increased in Early County and has changed little between 2012 and 2015 in Gwinnett County and Georgia. Remember, Catoosa, Early, and Gwinnett are the only ones who's using Generex for the prescription drug epidemic here in Georgia. So according to the same survey, actually, the percentage of the students that reported that somewhat or strongly disagree that it's easy to get prescription medicine that were not prescribed for them. Overall prescription drug access has remained higher in Early County and lower in Catoosa, Gwinnett, and the state of Georgia. Now, in this graphic shows the percentage of students who somewhat or strongly agree that taking prescription medication not prescribed for them is harmful to their health. Perception of harm of prescription medication has increased among the past several years in all counties in the state. The greatest increase is seen in Early County. So perception of harms remains lower than other counties and the state of Georgia. Now, let's talk about opioid overdose deaths by age group in Georgia. So the majority of overdose deaths from opioids in Georgia were from opioid pain relievers, OPRs, as you see, is around 549, followed by unknown, 149, heroin, 121, and a combination of OPRs and heroin, 81. The majority of deaths occur among residents 30 years of age and older, though a substantial number of deaths were among 20 to 24 years old, with a number of 74, and 25 to 29 years old, with a number of 126. So this is opioid overdose deaths by race, ethnicity, and sex in the state of Georgia. So the large majority of overdose deaths were among non-Hispanic whites, with 749, followed by non-Hispanic Blacks or African Americans, with a number of 124, as you see in your screen. There were 19 deaths among the Hispanic or Latino of all races. Most overdose deaths were among males, 550 as compared to females, 350. The overall age-adjusted opioid overdose death rates in Georgia was 8.8% per 100,000 people. So now let's talk about Gwinnett County. Opioid overdose deaths by age in Gwinnett County. There were a total of 75 opioid overdose deaths in Gwinnett County in 2015, approximately half of which were caused by OPRs, 36, followed by heroin, 14. Nearly 3/4 of deaths were among residents 30 years of age and older, as you see on your screen. So now the opioid overdose deaths by race, ethnicity, and sex in Gwinnett County. The majority of overdose deaths were among non-Hispanic whites, 56, followed by non-Hispanic Blacks or African Americans, 10. There were 5 deaths among Hispanic or Latino individuals, 3 among Asians, and 1 death of an individual identified as a multiracial. Most deaths were among males, 55, as compared to females, 20. The overall age-adjusted opioid overdose death rates in Gwinnett County was 8.4% per 100,000. So this is Gwinnett County still. This is the number of poisoning, and poison rates has been trending upward from 2012 to 2015. So this table provides the number of poison per prescription type for 2012 to 2015, as well as the poisoning rates per 10,000 people. So on table 1 on the top, you're gonna see the number of poisonings per substance type. And on the bottom, table 2, it's a poison rate per substance type. Remember, this is only Gwinnett County. Okay, so our needs assessment results and intervention strategies after all these founds. Our campaign actually yielded some extraordinary results. On table 1 on the top, you can show the results of our 2013 needs assessment, where the community scored at the lowest level of community readiness, which was level 1, meaning no awareness at all. On table 2, on the bottom, show the results from 2017 needs assessment, where the community scored a level 3, which signifies vague awareness, which means that the community feels that there is a local concern, but there is not immediate motivation to do anything about it. With this in mind, we proceed to look and prioritize our intervening variables and contributing factors combination, or IVCF. For this process, we had the collaboration of 6 members of CHISPA's coalition, which is the Hispanic Coalition for the Prevention of Substance Abuse in Gwinnett County. CHISPA's participants first assign scores across 4 axes: importance, impact, changeability, and capacity. In terms of importance, each IVCF combo was given a score that reflected how important participants failed, it was for this combination to be addressed. Next, the score of each IVCF combo based upon how much impact there will be if positive changes occur. Also, they assign a changeability score based upon how likely it was that we will see a change in this IVCF combination in the next 5 years. Lastly, they gave a score to each IVCF combination that reflected the coalition's capacity to affect change in this area within 5 years. Chispa's participants then determined the mean score for each IVCF combination and ranked them based on scores given. So our results. According to the scores, we identified 3 combinations of risk and protective factors in the community. First one was availability, then access, and social and community norms. So after discussing of these 3 combinations, will be better to work with the community. Chispas members and the general staff agreed to work with access, with proper storage and and the disposal and social and community norms, youth perception or perception norm. So these 2 strategies were chosen to address these risk factors in the community. Haynes model for the positive social norm campaign and social access media campaign. So let's talk about our positive social norm campaign. So the positive social norm strategy will be implemented in Gwinnett County High Schools. We wanted to change the perception of high school students have about abuse and misuse of prescription in their own schools. Each school will have personalized messages according to data collected in the perception surveys with their own students and the Georgia Student Health Survey, which according to the 2017 data, prescription drug misuse among Gwinnett County students has been declining since 2014. We started our positive social norms campaign in 2018 and began to collect surveys at Middle Creek High School. A total of 404 surveys were collected from April 23rd through the 27th. Based on the results of the surveys collected through the month of May, we work on developing the messages to be used in the campaign and recruiting teens for focus groups to test the message. We had 3 youth focus groups and 1 adult group for this strategy. At the end of August of 2018, we were ready to implement the campaign. Well, but before to post the message in the school, we had to have the principal's approval, which delayed the process 3 months. We were finally able to post our first poster with the design approved by the principal on November, which is the poster that you see right now on your screen. We distributed 24 posters throughout the school. Next month, so for the month of February, we will change the message, which will be posted for 8 weeks, and then we will administrate both surveys to be evaluate the strategy. Okay, so now our social access media awareness campaign. So for this new implementation plan, we decided to develop new messages that will help us to obtain the desired outcomes, to reduce availability of prescription drugs by raising awareness about prescription drug misuse and promoting safe storage and disposal of prescription drugs. All these messages are bilingual, English and Spanish. And for the pharmacy bag, this time, we had the opportunity to provide the messages in other Asian languages. Something that we found out is Gwinnett County has a growing Asian community, and we wanted definitely to expand our reach. So the next few slides, I will present the messages that are currently running in our local Gwinnett newspapers and billboards. I want to mention that for the fiscal year of 2018, the estimate media campaign was total of 50,484 individuals were reached, included radio, billboards, TV channels, and newspapers, all these English and Spanish language. Now you see on your screen the billboards actually that we are running in Gwinnett County, English and Spanish. Here are newspaper ads, English and Spanish as well. This is actually 2 Hispanic newspapers that have been very supportive. On the top, you see La Visión with a monthly distribution of 10,500 copies in Gwinnett only. And on the bottom, we have El Nuevo Georgia with 20,000 copies bi-weekly. We have 300 readers per month in Gwinnett only. So now I want you guys hear our radio PSA, first in Spanish.
¿Sabía usted que uno de cada 4 jóvenes ha abusado de medicinas recetadas?
Muchos de ellos los consiguen en sus casas, la de sus amigos o familiares. Esté alerta, vigile sus medicamentos, guárdelos bajo llave. Este es un mensaje de CEPA, el proyecto Generación RX y el Departamento de Salud de Comportamiento y Discapacidades del Desarrollo.
Okay, this Spanish PSA is running in La Zeta, which is right now one of the biggest Spanish radio station in Georgia. Now we are having 95,874 monthly reach in Gwinnett only. Now I want you guys listen that in English.
Did you know that 1 out of 4 youth has abused prescription drugs?
Most of them find them in their own homes. Friends and relatives, be alert. Keep an eye on your meds and lock them up. Every pill counts.
This message is being brought to you by SETPA, Genrix program, and the Department of Behavioral Health and Developmental Disabilities.
So this one is running in the Bull, which is one of the biggest radio stations in English here in Georgia. The monthly reach of this radio station is 440,116, only in Gwinnett County. They have a mobile app that in Gwinnett County reached 934,276 people. And also they have a website that Gwinnett County population actually is. Listen to this through the website is 46,056. Now I want you to show you the TV.
Do you know where your meds are? Kids can easily get into unprotected medication adults have left out unattended. Protect your kids, lock your meds, stop prescription drug abuse.
So our English TV PSA, which it has not been possible to run in television or American television networks due to the high cost. For the Spanish television, we're still using the old PSA. Something that I would like to highlight about the media campaign of 2017 that we're using right now is that all our media campaign messages actually were developed by Hispanic youth and young adults to target adults. So our workshops or parents presentations. So during each presentation, we still bring in printed material that parents or adults can bring to home and talk to their families and kids about prescription drugs and other drugs. Also, we raffle 2 security prescription boxes and a bag with other promotional material. A total of 107 parents, including schools parents outreach in Gwinnett County, attended the presentation during the last year. Our pharmacy bag campaign. So during the last 2 years, generous staff partnered with a total of 22 independent pharmacies in Gwinnett County. We have 5 in Duluth City, 11 in Norcross City, 3 in Lawrenceville, 1 Loganville, and 1 in Suwanee. So we translate the pharmacy bag message in 6 different languages appropriate for the community that is living in Gwinnett County, as I mentioned before. These languages included English, Spanish, Korean, Vietnamese, Urdu, Gujarati, and Hindi. 118,000 bags were distributed during 2018 fiscal year. The pharmacy staff report being pleased with the pharmacy bag campaign, and they mentioned that they feel the campaign is serving to increase awareness and generate discussions among customers. So now on your screen, you can see the different languages. So our pharmacy bag is one of the best known strategies in our community. Since the beginning of the program, the Hispanic newspapers have made several articles about this strategy that every day helps in the increase of awareness about the proper storage and disposal of medicine. So currently you can see one of the last, probably I can say, the articles one of the newspaper actually create for us. So finally, as part of our awareness educational campaign of proper storage and disposal, since April of 2016, General staff has been helping Gwinnett County law enforcement to implement the DEA prescription National Take Back Day. We started creating an English and Spanish press release a month before of the event. This press release is sent to different English and Spanish media outlets, such as radio station, newspapers, and TV channels. So now you can see some pictures of the collecting days and one of the articles that actually they put it on. So thank you very much for your time. And now let me see. Here is my contact information. So let's turn to Doka.
Diana, thank you so much. Wonderful information that you are providing us today. Now we're going to move to the QA sessions. We are, as a reminder, you may ask Diana a question by typing your question in the QA bag, and I will present the question to Diana. We may not have time to answer all the questions during this live event. However, we want to ensure we provide answers to as many questions as we can. In the event that we run out of time, we will take of the text of the remaining question, work internally to answer them, and we'll email on any follow-up information. So let's proceed. So now we have the first question from Sue. They say, Diana, hi Diana, would you be willing to share a copy of your need assessment report and any primary data survey that you use in your need assessment of the communities for this project?
Of course, anything you need, let me know. You can actually email me and I can help you as much as possible. Thank you.
The next question that we had come from Jose Luis Vasquez Martinez. This information on text messages is awesome. If there is any report available.
Yes, actually, I can email you guys, or we later can email you the DBHDD Generics page, so you can see actually all those reports, not only for Gwinnett County, you can see actually Catoosa County and Early County as well, because as you know, guys, not every community is similar. Actually, as I mentioned in my presentation, Gwinnett County has the largest Hispanic community in the state of Georgia. For Early County and for Catoosa County, they do probably have like a 1 or 2% of Hispanic community. So sometimes you can see that probably that's gonna help you more than my report, because you probably have less Hispanic communities than other counties in your area.
Perfect. Now we have Luis Moncada. Luis Moncada saying, can you share your PowerPoint database on your research, please?
Sure. Again, yes, definitely. We're gonna try, actually, I think We're gonna share everything that we have done, plus questions and everything later.
Yes, the next question is from Nara. He said, I was asking about the parents' presentation to raise drugs awareness that was part of the program. Probably she wants to learn more about it.
Okay, so for this parents' presentation, actually, we create something very simple, even with the language. Something that we found out in our Hispanic community is that most people, they just did elementary school. So language, it has to be very, very basic. In the same way, the presentation. So each slide, it has to be very simple. It has to be very graphic, you know, and show every single thing as possible. So very detailed. But I don't know, all depends of the community that you're working on. Sometimes I'm seeing another places, like another counties here in Georgia, where the Hispanic community is not at that low level. It's a little bit higher. So all depends of that specifically.
Yes, and the next question is from Rene Rivera. Rene wants to know if will strategies, give me 1 second, I'm sorry. Is Jessica Trujillo, what strategies or techniques that are recommended to be discussed?
Wow, all depends on your needs assessment, Jessica. It's very difficult to just implement something that you don't know is gonna actually work or not. All depends on the needs assessment, all depends definitely on the level of readiness. That was something that happened to us. If you've seen the first needs assessment, we had a very, very lowest actually information in our community about prescription medication. So we had to start it from scratch. So that's why we use media campaign and we use the workshops. Now, when I'm seeing, or we were seeing that our community is on higher level, yes, we're still doing the media campaign because we're seeing it's something that is helping us a lot, not just for those that they started and recognize the problem, but for those that already recognize the problem, they know the problem. But if you see it, we started this time with positive social norms with kids, with high school students. And that was based on our needs assessment, on the second needs assessment. So everything, every strategy, every technique, definitely it needs to be dependent on your needs assessment and your logic models.
Perfect, thank you. The next question is coming from Rene Rivera. He said, how is and where the illiterate individual address, or was this even an issue?
Definitely is an issue. It is an issue. Thank you for your question. This is actually something that probably all of us in each community, doesn't matter if it's Hispanic, we can see it in Asian community, we can see it in American community, African American community. We have a lot of people with low education in many ways. So as I mentioned it with the workshops, we definitely need to know very well our community and talk to them, and whatever we're gonna present to them, it has to be very basic. Sometimes I still using my basic workshop or my basic language to people that know a little bit more about the issue. But why? Because if they want to, you know, like provide that information to other people, it will be simpler for them to understand and to teach them.
Thank you. Okay, Nancy Restrepo say, are there any of the videos and messaging available to use?
Sure. Well, the messages that you show in my presentation, we have it in our YouTube page, on SEDPA page, actually. I don't know if we can use it. I probably need to talk to my supervisors about it and see if we can use it or not, but I'm pretty sure you can do it anyways. Genrex and DBHDD, they have a lot of other videos in radio PSAs that anyone can definitely use. So if you want, we can send later actually, I don't know, their website so you can see everything.
I think we're gonna share Diana's contact information also in a way that it's important for you to have it. And we're gonna continue answer a few more questions, maybe the last question right now. And let's take this one. Sarai Beltran, he say, is the percent of use of alcohol and drug use in red blue chart from the PowerPoint at the rate in Georgia or nationwide?
Okay, everything was actually prescription medication. It wasn't anything about alcohol. And oh no, I remember what was, I'm sorry, I can't remember which chart do you mention it. That chart actually, that's at the beginning, yes, you're right. That chart is national.
Thank you. Now, we still have so many questions, but we're gonna continue. Thank you, Diana, for the wonderful presentation. Also, thank you, all of you, for your wonderful questions and inputs that help us to enrich this presentation. We have very positive feedbacks. In the question chat, we see that people comment that they have a huge Latino communities, and this presentation has been very useful. So thank you. Diana, I would like to especially thank you for today's contribution and for all the amazing work that you are doing in our community. As a friendly reminder, we will be archiving a recording of this event, and we will provide access very soon. Also for the PowerPoint presentation, a PDF will be available after you complete the completion of the survey. In the next two slides, you will find the information for the National Hispanic and Latino PTTC, our Addiction Technology Transfer Center. Please reach out for more information about our project and to request free training and technical assistance. Thank you again for joining our webinar, Prescription of Prevention Drugs Misuse Among the Latino Community. At the end of this webinar, you will be redirected to another page to complete the evaluation. We appreciate your participation. Thank you. Gracias. Obrigado.